Now, I don't do these things to scare you, I swear I don't. I'm just keeping you informed because for some reason they don't want us to be informed. The Kansas tuberculosis cases have been happening since January 2024. So not get too wrapped up in the headlines. What even is tuberculosis? You know we're going to talk about it. So tuberculosis is an infectious disease caused by Mycobacterium tuberculosis, which is a bacteria. Tuberculosis affects the lungs primarily. It also affects different parts of your body, such as like your kidney, spine, and your brain. So for tuberculosis is spread through the air. So if someone coughs, speaks, or sneezes that has active tuberculosis, they can spread the bacteria everywhere, and your risk for exposure is very high. So there's two forms of tuberculosis. There's latent tuberculosis, where you don't show any signs of symptoms, and you're actually not infectious, but it can develop into active tuberculosis. And active tuberculosis is when you actually start showing symptoms. So common symptoms of tuberculosis are persistent cough that lasts for like weeks, chest pain, you can cough up blood or sputum, unexplained weight loss, fatigue, fever, night sweats, chill. Can also vary depending on what organs have been affected. To diagnose for tuberculosis, we usually use skin tests, blood tests, x-rays, analysis of sputum symptoms. So sometimes in the lab we'll get a sputum sample and we'll stain it and look at it to make sure if the bacteria looks like Mycobacterium tuberculosis. Detection is actually very essential in order for a treatment plan to be set. The treatment for tuberculosis is, since it's a bacteria, that means antibiotics. Antibiotics, if found early and you fulfill the full treatment plan, can cure tuberculosis or develop drug-resistant tuberculosis. So to prevent tuberculosis, there are vaccines offered. We don't use them very much in the US because it's not very effective in adults. We screen a lot for tuberculosis. So if you're a healthcare worker, I've usually either get like a tuberculosis skin test, or you can get a blood test. You test for tuberculosis. It's called a T-spot. For prevention is making sure that your area is well ventilated. The thing about tuberculosis, it's spread the easiest indoors because of how infectious it is. The spread of tuberculosis, the case amount is in Kansas with about over 60 active tuberculosis cases. There are some cases in Michigan, specifically at a Michigan high school, for active cases of tuberculosis. So don't be afraid, be cautious and vigilant. There is risk of it spreading to other places because diseases travel. They don't know borders. They will travel wherever they need to travel. So